Hi, my name's Andrew Zeft. I'm a pediatric rheumatologist at the Cleveland Clinic. I'm here with Blake Bal, who's a 12-year-old boy who I had seen for his problem with Henoch-Schonlein purpura. Henoch-Schonlein purpura, often abbreviated HSP, is a systemic vasculitis that occurs in children and adults. It's most commonly presents in childhood. Typically the age range is 3 to 15 years. The most common age of presentation is in the grade school years, 7 or 8 years old. The etiology of the disease is unclear. The immunology involves IgA deposition, but there's thought to be a combination of genetic and environmental influences, and in about half the cases, a viral infection, upper respiratory infection, or often strep infection can trigger the illness. So Blake, when you first started getting symptoms of your problem, what did you experience?
Well, first I had these red skin lesions on my, mostly my legs, and what we thought is that they were mosquito bites, actually. And so we kept calm, and then I started getting more and more and more. And that's about the time I got bad stomach cramps, and I couldn't really eat anything, or I'd vomit it up. And I was really sore in the joints. Standing up was hard because it hurt so much.
And what joints bothered you?
Mostly my knees, my shoulders, and my elbows.
Do you remember them being swollen?
Not really, but they might have been.
And then your abdominal pain or stomach pain, how did that feel?
It was really, really bad because sometimes it felt like I couldn't even move. It was so bad.
Did it get worse and then get a little better and get worse and a little better, or just stay like it was?
It kind of came in waves. So at the start, it would just stay bad for say 5 hours, and then it might have let up a little bit. So then that was about the time I would get something really light to eat, and then it would come back and it would be bad.
I see. And then when your skin sores first occurred, they changed some over time, didn't they? How did they look to you?
Well, first, I really thought they looked like mosquito bites because they were kind of small, about the same size, and they were kind of raised a little bit. And then at some points they were a little itchy, and so then they just started to come and come and come, and at that point they weren't really raised anymore. They were kind of closer to the skin, and they were a lot smaller. Some were really small, about that big, and some were kind of bigger. And it was really weird because they were covering my legs. I had a lot on my stomach.
Did they change color over time?
Not necessarily. I don't remember.
Did some look purple, or was it more red to you?
More red.
And then I remember we started you on prednisone, and we did that because your abdominal pain was bad enough and you were vomiting and having trouble eating. Did that make you feel better?
Yeah, it helped a lot, actually.
What did it help?
It made the stomach pain lessen, and my joints felt a little better, I think, because I don't know if that was from the medicine or I was just kind of looking to the positives, maybe because my stomach pain was going away. But yeah.
And then you remember we checked blood tests a few times, but we also kept checking to make sure your urine looked normal. Do you remember that?
Yeah.
And then you saw another doctor in addition to me, Dr. Kwan here, and he's a renal doctor, and that was partly because you had some protein and some blood that developed in your urine, and that's slowly gotten better over time. And now you're almost a year away from the initial presentation, isn't that right? And I think you have a final visit with Dr. Kwan, or maybe more, but things are going really well, aren't they? Are you on any medication now?
No.
Do you feel any effects of the illness?
Not
I
anymore.
see. Do you remember when that went away? So you had, if things started about a year ago, how long it took to sort of feel normal again?
I'd say I felt normal. I want to say after 3 months, I think. Because, like, before that, even, like, late into that time, it felt kind of weird. Like, I felt still a little sore.
I see.
And, yeah.
Sore in your joints or sore other places?
Yeah, just sore
Still
on
in
my
your
joints.
knees and your shoulders?
I think a little, yeah.
And then just to go back, when you first presented with the problem, do you remember being sick before that? Or did it really just come out of the blue and you thought they looked like mosquito bites?
Yeah, I think they just came out of the blue. I might have had like a small cold before that, but I'm not sure.
I see. Well, thank you for talking with me today.
Yeah.
Henoch-Schonlein purpura, or HSP, is well described by our patient here. Is a systemic vasculitis, occurs primarily in children. It typically self-resolves. So Blake had a typical case, but his also required oral steroids, primarily for his abdominal pain, out of concern to prevent a smaller complication in patients that can be called intussusception. Blake has done well, like most patients. It's not uncommon to have some residual proteinuria, but to not require chronic medication or long-term follow-up. There are small subsets of patients that can have renal problems, but over time are more chronic issue, but typically things self-resolve. All right, well, thank you.